Some of my research has been looking at how parents view the HPV vaccine and then looking at how that compares to what providers think parents think about the HPV vaccine. Parents, when they're looking at the importance or rating the importance of the HPV vaccine, rate it as equally important as the other vaccines, MMR, the Tdap vaccine. When you look at what providers think parents will rate the vaccine as, even though parents rated it in the sort of 9.3 range, if you will, if you're sort of looking at the scale, and all other vaccines were in the 9 to 10 range in terms of importance. Providers predicted that parents would rate the HPV vaccine somewhere in the 5 to 6 range. And I think that really affects the strength of any provider recommendations. Parents are going to providers to get reassurance that it's a great vaccine because it's a great vaccine. And providers are missing the message a little bit in general. So I think a lot of providers and some parents get caught up in the idea that the target disease for this vaccine is a sexually transmitted disease primarily. Well, it doesn't really matter how somebody gets the disease. The bottom line is people get the disease and people die from the disease, and we have the opportunity to prevent it. This is a vaccine that prevents cancer. There is no relationship with getting an HPV vaccine and the onset of sexual activity. In fact, the only thing that I've seen in the literature that has changed is that for those who have received the HPV vaccine, they're more likely to use condoms when they do actually have sex, primarily because I think providers are using the opportunity for those for whom it's developmentally appropriate, using the opportunity of giving the HPV vaccine to also discuss safer sex practices.